One of the key players in the industry is here in New Orleans. HIMSS13 TV's Erin McCann talked with him about the nationwide health information exchange.
Everyone comes to HIMSS in search of answers. If one person has them, it's Dr. Farzad Mostashari, National Coordinator for Healthcare IT. I caught up with Dr. Mostashari on the show floor to talk about the state of healthcare IT. What important HIT issues have arisen in the past decade that we really didn't fully anticipate back in 2004?
Can I show you?
Oh, please.
That is an issue that we did not anticipate in 2004, that there would be patients who are passionate advocates for the patient's right to get their own information. Some have called it a new civil rights movement. But I think it's going to be the patient and their caregivers are going to be at the center of the new revolution and transformation in healthcare. They're going to be right in the middle of it. And that's something, back in 2004, we were thinking doctors, hospitals, electronic medical records. And I think the next 10 years is really going to increasingly be about the patient.
Now, many would argue, that the answer is you, but from your perspective, who has been the most influential leader in health IT over the past decade, and why would you say that?
Definitely not me. It's hard to argue that the single biggest driver has been high-tech. The High-Tech Act, which finally put some real resources and real supports and really ability to put standards into the healthcare IT marketplace. So the high-tech program, and we have to really give credit to the president, who made it part of the agenda, making sure that was part of the American Recovery and Reinvestment Act.
What topic are we not talking about today that we will be vigorously talking about in 10 years or so?
Let me tell you, my vision for 10 years from now is that we have smart health, which means smart patients and smart physicians that are aware of all the world's knowledge at the moment of that encounter. And this is the key part that I think we'll be grappling with 10 years from now, how to make every medical encounter contribute to the world's knowledge of health, healthcare, public health, safety, preparedness. So it's that vast world of creating not just a system that is aware, but responsive and learning as part of the exhaustive healthcare.
Now, some big news was announced the other day with interoperability. McKesson, Allscripts,
Yeah.
Athena Health, Cerner, and Relay Health announced, that they were forming an interoperability alliance. What's your response to that?
I think it's great. I think it's great that the market is responding to what the customer wants. And interoperability is now being talked about as, in a way that it really wasn't 2 or 3 years ago, as a must-have and as a differentiating factor for the vendors. So I see this as a really positive reflection of the fact that the business case is now here for hospitals and providers who are buying systems to say, we demand interoperability. And the market is responding. That's what we want.
So are there still some vendors who are not, pushing towards interoperability?
There may be now, but I don't think there will be in the next year or so, as it becomes an overwhelming business driver, right? The marketplace is making it very clear they want interoperability, and the vendors that succeed, the vendors that thrive, the vendors that survive will be the ones that can deliver to the market what the market wants.
Thank you, Erin, for unveiling that look into the future.